MOH to fine private clinics over medicine prices from October 2025. What you need to know. Imagine this. You walk into a private clinic hoping to get the medicine you need, but you can't find the prices displayed anywhere. This is about to change, and it's a big deal. The Health Ministry, MOH, has just announced that starting October 1st, 2025, private healthcare facilities that fail to display medicine prices will face compound fines. But here's where it gets controversial. Full enforcement won't kick in until January 1st, 2026. Why the delay? Let's dive in. The MOH has been working on an educational enforcement phase since May 1st, 2025, which will continue until September 30th, 2025. During this period, the ministry has been conducting inspection visits and advocacy sessions to ensure that private healthcare facilities and community pharmacies comply with the new regulations. Those who don't comply may receive reminder notices, but starting October 1st, 22, GP fee hike stalled. Dzulkefly defends Act 723 for drug price transparency in Malaysia. The proposed increase in general practitioner GP consultation fees has hit a roadblock, and Health Minister Dzulkefly Ahmad is standing firm in his defense of the drug price display regulations under Act 723. On August 4, 2025, in Kuala Lumpur, the Cabinet directed the Ministry of Health MOH to enhance its proposal regarding the review of private GP consultation fees, which have remained unchanged for over 30 years. In a written response to Gopeng MP Tan Kar Hing during a session in the Dewan Rakyat, Dzulkefly confirmed that the MOH had submitted a paper to the Cabinet concerning this review. However, the MOH has been tasked with refining the proposal and continuing discussions with stakeholders and interested parties, Dzulkefly stated. The Medical Practitioners Coalition Association of Malaysia, MPCAM, has previously suggested increasing GP consultation fees to a range of 50 to 80 MR, a significant rise from the current rates of 10 MR to 35 MR, which have been stagnant for 33 years. Notably, Dzulkefly's response did not disclose the specific fee rate proposed by the MOH in its cabinet paper. In the same response, the Health Minister defended the jurisdiction of the Domestic Trade and Cost of Living Ministry, KPDN, over the MOH's drug price display policy, which is enforced under the Price Control and Anti-Profiteering Act 2011, Act 723. Tan, a member of the Pakatan Harapan Party, questioned whether the MOH was contemplating a more equitable approach to displaying medicine prices rather than adhering strictly to Act 723. The Price Control and Anti-Profiteering Price Marking for Drug Order 2025, effective from May 1st, mandates that private healthcare facilities and community pharmacies display the retail prices of medicines. Medicines are classified as pharmaceutical products under the Sale of Drugs Act 1952 and the Poisons Act 1952, along with their respective regulations. The Price Control and Anti-Profiteering Act 2011, Act 723, provides a valid legal framework to ensure price transparency in sales transactions, including the sale of medicines in private healthcare facilities and community pharmacies. Dzulkefly explained to Tan. He emphasized that the display of medicine prices is merely an informational tool regarding the selling prices and does not serve as a price control mechanism that would limit the professional judgment of medical practitioners in addressing patient needs. Dzulkefly characterized the requirement for displaying medicine prices as a step aligned with the government's goals of promoting price transparency, protecting consumers, and fostering a fair and competitive healthcare market. Furthermore, he clarified that pharmacy enforcement officers from the MOH have been authorized by KPDN to act as assistant price controllers in enforcing the drug price display order under Act 723. These pharmacy enforcement officers are qualified professionals with expertise in pharmacy and have experience in inspecting pharmaceutical products and healthcare facilities that dispense medicines to patients, Dzulkefly noted. He added that enforcement actions at private healthcare facilities and community pharmacies will involve MOH pharmacy enforcement officers, ensuring a comprehensive approach to compliance with legal requirements. Dzulkefly reiterated that the MOH had engaged with stakeholders before implementing the drug price display policy, including meetings with industry representatives and healthcare providers on November 2, 2023 and August 13, 2024. Public consultations were also conducted through the government's Unified Public Consultation (UPC) portal from July 15 to August 20, 2024. Along with an advocacy session for private healthcare providers on February 27th of this year. The feedback from these engagement sessions indicated that most stakeholders, particularly consumers, were in favor of the drug price display implementation, despite concerns from private medical practitioners regarding enforcement and the burden of outdated consultation fees. The health minister stated. Dzulkefly's comments in the Dewan Rakyat on July 31st marked a shift from his earlier statement on May 13th, where he had committed to reviewing a proposal from doctors' groups to transfer jurisdiction of the drug price display mandate to the Private Healthcare Facilities and Services Act 1998, Act 586. This proposal followed a significant protest in Putrajaya on May 6th, where over 700 doctors rallied against KPDN's control over medicine price display. Recently, the government reversed its position on the grace period for enforcing the price display, with the MOH and KPDN announcing that educational enforcement would only last until September 30, rather than until the outcome of a judicial review as previously promised. Starting October 1st, penalties for repeat offenses will be imposed. And full enforcement is set to commence on January 1st of the following year, as the MOH and KPDN noted that the court has yet to issue a stay on enforcement. 2 judicial review applications have been filed in the High Court to challenge the Price Control and Anti-Profiteering price marking for Drug Order 2025, one by a group of 8 applicants, including medical and dental associations and an individual GP, and another by a doctors' association and a clinic operator. The case management for the lawsuit involving the 8 applicants is scheduled for August 22nd.